Well, good morning and welcome to Town Hall presented by the Detroit Regional Chamber. My name is Brad Williams. I am the Vice President of Government Relations at the Detroit Regional Chamber, and I have hosted, I don't know, dozens of these over the course of the last year. And I don't know that I've ever had one that I'm more excited to host. I have with me today Dr. James Grant. He is the Senior Vice President and the Chief Medical Officer for Blue Cross Blue Shield of Michigan. And our topic today is the vaccine. And when I say the vaccine, it really is vaccines, because there are two vaccines that are being administered to patients in the United States, and there are others that are being administered worldwide and maybe coming to the United States soon. I was telling my wife and my team before this call, I'm going to really have a hard time on this webinar not asking the same question over and over again. And that question is, can I get my vaccine yet? Because I don't know about you, I'm chomping at the bit. As soon as I can get one, I'm excited. But we're going to talk to Dr. Grant about the vaccine, and we really want to take the time to answer any questions you might have, because there's a lot of questions out there, and we're not going to get back to normal until we all, or a good chunk of us, get the shots in our arms. So if there's questions out there, we want to make sure that you get answers to it, so you're comfortable getting the shot in your arm. So Dr. Grant, thank you so much for taking some time for us and for our members today. But I just want to start by, asking you about the approval process of the vaccines that we've got so far. We've got Pfizer and Moderna that are going into patients' arms in the US as we stand. Can you kind of walk through, what's happened from March of 2020 to now February of 2021 and how we've gotten to this point? What is the approval process for these vaccines that have been authorized so far, and the ones that we hope will be authorized soon look like to get to this point?
Well, thanks, Brad. And actually, Brad, you're putting a lot of pressure on me, saying you've never been so excited about doing a webinar. We got to make this one really work.
I mean, I told you beforehand, the door's right next to me. I keep hoping, the vice president, the president, they're getting their shots in public to give confidence. I'm hoping someone's going to knock on my door and stick a needle in my arm to give confidence to everyone who's watching. So that's what I'm excited about.
You and millions of other Americans. And great, Brad, that's really great to hear. So there are two vaccines, and really one of the most common questions is why did this one get approved so quickly? Well, I think we know why it had to be approved so quickly. But one of the beauties of how it could be approved so quickly is we did two things. The government actually did some things that we don't usually do, but they didn't impede on safety. The other one is because of, you've heard of SARS before. It's a respiratory disease.
For sure.
And this is essentially one of the same viruses. So there was already work in progress to develop a vaccine for SARS. So it was already there, the groundwork was already there, the framework was already there. So what the government then did, the FDA then did, and I've got to give them credit for it. Normally, when we get new anything, we have phase 1, phase 2, phase 3. Well, there's certain things that really didn't impede on safety that they said, okay, let's do these two things in parallel. So while they were doing like some of their paperwork and administrative lab work, they were also doing clinical trials in 40 to 50,000 people. So normally that wouldn't have taken place in parallel. It would have taken place in series. Things like that made it so that we could really get the vaccine out quicker. That I've got to give, like I said, got to give the FDA and the CDC a lot of credit for.
So, everything that I've seen from medical experts has suggested it's safe, and we got to trust science, right?
Mm-hmm.
But what should we expect, when we get the shot? What should we expect as far as side effects? So when it happens, we know that nothing unexpected is happening. What should we expect?
Every person is different, Brad, and I'll give you, one of the things you can sometimes expect is no reaction. I'll give you personal anecdotes. So my wife got the vaccine. She's a physical medicine and rehab physician. She also does a lot of work in nursing homes and hospitals. She got the vaccine. So she got the first vaccine. Her arm was a little a little sore. Very normal. Even when you get the traditional yearly flu vaccine, your arm can be sore. First vaccine, she was fine. Second vaccine, she was extremely, extremely tired. And one of the known side effects we have of the shot, of the vaccine. But it lasted 24 hours. My son's a first-year medical student in Houston. He got the first, and I'm going to give you an example because she got Pfizer and he got Moderna. First shot, a little soreness in his arm. The second one, and he had planned, he scheduled everything so he wouldn't have anything to do day two. He was tired, but he mostly had a headache. Again, hour 25, it was all gone. Then some people get nothing. What I've heard, chills. Chills are a big one. Fatigue is a big one. Headache is a big one. Myalgias, or in other words, for just muscle soreness, that's a big one. So these are the side effects that we're hearing. Always have heard from everybody. After that day two, they're all gone. So if you can just get through it, and they're not anything that's debilitating that will have you just beyond yourself, you know they're coming. It's usually after the second shot. It can be after the first shot. I bet if you get it after severe symptoms after the first shot, you may have had COVID and not had known it in the past because you'd already been sensitized to it. Usually after the second shot, if you don't get, so the next natural question is, well, if I don't have any symptoms, does that mean my vaccine's not working? There's no correlation.
So what you're saying is before COVID, when we were going into shutdown, I bought myself an Xbox, my first video game system in like 15 years. I should plan on when I get my second shot spending a whole day with my Xbox. Is that what you're saying, wrapped up in a blanket?
I think actually, Brad, in your case, we could probably just wrap you up in a blanket, put a laptop on your chest, and you can probably get some work done.
Oh, okay. I don't see Sandy watching this, so I'm just going to pretend that didn't happen. So the COVID-19 vaccine, if we want people to trust it, we need to be honest with them and tell them that there's some people who probably shouldn't take it, right? Because there's sensitivities, right? So who are the people who shouldn't take it?
Basically, it's the same people that the same criteria we had for the flu shot, and the same people who have sensitivity to vaccines.
Okay.
That's one of those things that I hate to do this to anyone that's watching. At the end of the day, everyone's a little different, especially something as sensitive as allergies. Talk to your physician.
Okay, that's great. So how many other vaccine candidates? I mean, I mentioned this a little bit at the top. I mean, you hear about Johnson & Johnson and, AstraZeneca, we heard really early on had some hiccups in their testing. So I know of at least 2 other candidates for vaccine are out there. Are there any others that are waiting for authorization? And do you have a sense of when we might hear more about those and when we might get approval and maybe more kind of vaccines in the pipeline?
Brad, the only one I know that we're actually, quote, waiting for authorization is J&J. Okay. Because they've submitted to the FDA. All the others are still in research and development. Mm-hmm. So they haven't been submitted to the FDA yet. J&J has the FDA has J&J. So that's the next one. And J&J is a little different insofar as J&J is a one shot. So you don't have to go back for that second shot.
So I was reading over the weekend, and anything I see about vaccines in the news, I read. You read about the 2 that people are getting right now. I think they're saying kind of 95, 93% efficacy, and but you see the Johnson & Johnson number is lower, right? I think it's like 66% efficacy. Could you explain to the folks? Is a little higher than that, but exactly what that means? Because at first, in my mind, when I heard for the 95% number for the Moderna the Moderna and the Pfizer, I thought that meant it worked on 95% of the people. But as I read more, I'm understanding that I got that wrong, that it will prevent you from getting COVID maybe in 95% of exposures. Is that right? Could you maybe explain that to other folks? Because I've been reading more, and even that the Johnson & Johnson number, even though it's quite a bit lower than Moderna and Pfizer, is actually a really good number still.
Okay. So I don't know if you know, so when you get the annual flu vaccine, do you know what the efficacy number is for that?
No idea.
50%. So what it does when we talk about efficacy numbers, it's really is like, what are the chances of you getting it? Mm-hmm. Of you getting COVID. And sometimes it's not even necessarily, Brad, of you getting it, but it's also of you getting the symptoms. We've already seen over the weekend, we've seen some people who had the vaccine and they were normally screened, and there was all this angst, but there was nothing to be anxious about. So they had actually had both of their boosters. They had their first, they had their second. They were good. They had at least 10 days after their second. They had it because of the nature of their positions. They had routine screening. They screened positive. It can happen, but none of them had any symptoms of COVID.
Mm.
So that's what the vaccine will do. You can still get COVID. You can still be positive for COVID. You just won't get the symptoms. Or if you actually get COVID from even having the vaccine, let's say you would have been in an ICU on a ventilator. Maybe you would just be in the hospital. Let's say you would be in the hospital. Maybe you would just be seen as an outpatient. So even if with the vaccine, you can still get COVID, but the symptoms you'll get and the progression of the disease will be much milder than if we didn't have the vaccine.
So let's talk a little bit, because we know, not just with this vaccine, but with just vaccines in general, there's a segment of the population that just doesn't trust vaccines and doesn't feel comfortable with vaccines. So, for that portion of the population that just, has assumptions about vaccines and their safety, what can you tell us about what we learned from the clinical trials about the safety of the vaccine? How does this measure up to some other vaccines that, maybe we take? You mentioned the flu shot, for example. How safe is this vaccine relative to others?
This vaccine is as safe, if not safer than others. Every vaccine's a little bit different, but there's no reason to think this isn't safe. Like I've said, my family's standing online for it or getting it or has gotten it. My friends, I'm telling them to get it. I can only lead by example. I think it's a natural worry. It's a natural worry when you're getting any kind of vaccine. I get it. I sympathize with it. But we got to take a look at the whole picture. There's a natural worry about getting COVID, natural worry about spreading COVID to your loved ones. When you start putting it all together, the evidence is just clearly there that you've got to try to get the vaccine. You've got to try to do it. That's the only way we're going to beat this. And if we can get the vaccine, and the vaccine's safe, the FDA will not release anything that's not safe. Over 1 million people I read this morning, have already gotten the vaccine. Well over 1 million people, which is, we have more people that actually have had the vaccine now than actually have had COVID. And we're not hearing about people, we're not hearing any side effects. We're hearing some of the ones and twos here and there, the things that could have happened even if you didn't get the vaccine, and were totally irrelevant to the vaccine. So I don't want to minimize any concern about the safety, but I do want to assure everyone that if I thought it was dangerous, I wouldn't give it to my family, wouldn't recommend it to my friends. The FDA doesn't release vaccines that it doesn't deem to be safe. I can't do anything more than that than say, hey, we got to do it. All the safety indicators say it's a green light.
So can you tell our members here about herd immunity? 70% seems to be the magic number that folks have talked about as far as how many people we need to be vaccinated to get to herd immunity. But then I've also seen reports that maybe with the new variants that we need to get to 90%.
Yeah.
Then you're seeing different efficacy numbers for the new variants with the vaccine. So I guess, could you tell us what your read on herd immunity is, why it's important, and how we should be thinking about with this? I mean, I know we don't know a lot about the new variants yet, but how should we be thinking about herd immunity in light of the new variants?
When it comes to the new variants, what I've got to say is treat the new variants just like the first baseline original entrant as COVID-19. We had in Washington County, we had the United Kingdom variant. We know about the South African variant. We know the explosion in Southern California was what they call the California variant. And the variants are more contagious. They're not necessarily more harmful. You're not necessarily going to be in a hospital sooner or in an ICU sooner or on a ventilator sooner, but you may catch it sooner. The example I like to give is United Kingdom. They say that the UK variant is 50% more contagious. What's that mean? That means if 1,000 people were to get the early entrant COVID-19 virus, that means for the variant, 1,500 will get it. So that's the variance that we're talking about. The beauty of it is, so far, all the vaccines, or at least Pfizer, Moderna has been pretty effective in not only entry-level COVID, but also the variants that have come out.
So I know, Dr. Grant, we don't have a clear answer yet as to whether someone who has been vaccinated can still transmit the virus to someone else. So for example, my mom is going to get her second booster, I think, in a week and a half. And so it's still not clear whether or not it's safe for me to hug my mom. When am I going to know whether or not I can hug my mom? Do you have a sense of when I can hug my mom?
Yeah, when we start watching the numbers and the numbers as they start decreasing. So as the numbers start decreasing, and we've already seen peaks and valleys, but as we see the numbers get below 5, 4, 3%, that's when we'll be able to sort of resume a more traditional life, or life as we knew it before. So those that have had the vaccines still need to wear masks. Those that have had the vaccines still need to social distance, still need to wash their hands. It should be business as usual in our new world, business as usual until we sort of have the green light. I mean, I know when my birthday is. I know when I pay taxes. We know when Labor Day is. There's not like we have a date. It's very odd for us. We're used to a defined date. On November 23rd, we'll celebrate Thanksgiving. On April 15th, we'll pay our taxes. We don't know. It's like, okay, January 1st, all masks are off, social distancing, go hug and kiss everyone you haven't seen in 2 years. We don't have that kind of definity, but we're working towards it.
All right. Well, let's a little bit before we open it up. We've got a lot of questions coming in from our audience, and if you have questions, there's a chat box in the GoToWebinar function. So in about 3 minutes, I'm going to have my colleague Cinciana come in and get to some of those. But I do want to ask you about the role that Blue Cross Blue Shield of Michigan is playing for their customers in accessing the vaccine. So I'm a Blue Care Network subscriber, but I'm sure a lot of the people who are listening in are customers of Blue Cross Blue Shield and all of your products. So what is the role that Blue Cross is playing in helping their customers access the vaccine?
So Blue Cross is going to pay all the administration fees. There's really 2 fees that go along with the vaccine. One is the actual cost of the drug. The federal government's taking care of that. The administration fee, Blue Cross Blue Shield is taking care of that part.
Well, that is really good news. There's a lot of, we talked about, some people who are nervous about the vaccine, and there's, some legit and, some illegitimate reasons I think people are nervous about the vaccine, including misinformation, whether it's social media or word of mouth. Are there resources that Blue Cross Blue Shield has, or other experts that we as everyday citizens can share with our loved ones that can provide some real factual based information about the vaccine to our loved ones that would help encourage them to get the vaccine so we can get to herd immunity?
Blue Cross Blue Shield has a phenomenal website that has every question you could have answered about COVID. And just go to our website. There's a hashtag. It's bcbsm.com/COVID, or you could actually go right to the bcbsm.com homepage and you just click on COVID. It's updated every day, sometimes twice a day, to give you the newest information. The state has a tremendous website on COVID. I encourage you to go there. One of the things about being a physician in 2021 is when patients see you. In the old days, patients came to see you. We talked about your problems. I'd say 3/4 of the time they've Googled up everything about you, everything about the disease, every symptom they've had. I love when I see a patient introduce myself and they'd know more about my background than I knew. Now, I know all about you. You went here for medical school. You went here for residency. You had these many patients comment on your bedside behavior. The internet's a whole world open to you, and there's plenty of information on there. But check out the Blue Cross Blue Shield website. The team does a phenomenal job making sure it's up to date.
Right. It's just when you go on the internet to find information, just make it sure it's a good information from trusted sources like Blue Cross Blue Shield.
And I can tell you the Blue Cross Blue Shield source is great. State of Michigan source is great. CDC source is great.
And you can go to the Chamber's website, which is detroitchamber.com/COVID-19, and we've been gathering reliable information on, not just the vaccine, but all sorts of other resources for our members as well. With that, we've got so many questions from folks. Cinciana, do you want to jump in here and try to prioritize the most important ones? We're not going to get to everything, but we can do this for a couple minutes, and then we will get back and let Dr. Grant get back to work too.
Yeah, thanks, Brad. And Dr. Grant, I just want to say thank you so much for being with us and having this very important discussion. We've gotten so many great questions from our audience. So first one is about vaccine safety in individuals with certain allergies, such as sesame or nut allergies, or certain deficiencies. Do you have any information about that?
I haven't heard any of those yet. As far as the sesame or nut, I haven't heard that one yet. And if I'd say that probably the greatest issue if you have a long list of allergies, or if you have a history of being allergic to the annual flu vaccine, then I would actually contact your doctor.
Okay, that's a good tip. So basically, check with your doctor before getting the vaccine if you do have any sort of allergies. Next one, I know you touched a little bit on this, but specifically, do you have any comparison in risk of death or heart sickness from those, contracting COVID with the vaccine versus those who didn't get the vaccine?
We don't have those tremendous numbers. We don't have the numbers yet per se like that. So let me get the question right. The question is, if person X got the vaccine, what is the chances that if they didn't get the vaccine?
Right, so comparing a risk of death or, complications, like you said, those who have the vaccine versus those who don't have the vaccine.
Okay, we don't have the exact numbers yet, to tell you the truth. We do know that it's going to be less. Okay. You can have the vaccine and still get COVID. The chances of you dying from COVID are exponentially less. The chances of you being on a ventilator from COVID are exponentially less. Same thing with the flu. When you get the flu vaccine every year, it does, people still get the flu. They don't get it as severely though. Same thing with the vaccine.
Great, thank you for that answer. We have a question. Should I be worried about which vaccine type is best for me? So whether Pfizer or Moderna?
No, they're essentially the same.
Okay. Thank you for that. So you've touched a little bit on the COVID-19 variants. And we've heard that they're more contagious. Can you explain how they are more contagious? Do we have any of that information available yet?
Vaccines mutate, or what they do is they sort of change the nature of who they are. And what they do is, and when this one changed its nature, it did, like I said, it didn't get more severe. It just got easier to catch. So and it's not unusual. All viruses will mutate. The question is, how many mutations are there, and how is the mutation affecting it in the long run?
So more to come on that, I'm sure, as we kind of continue through the process here. Thank you for that. So this is regarding vaccine education for businesses. What can businesses do to encourage employees to get the vaccine? What is your recommendation?
I have heard everything that a business can do. I think the best thing they can do is lead by example. Have the CEO get the vaccine. Show the team that he or she's getting the vaccine. Do everything you can to get the resources to get your team the vaccine. Encourage everyone to get the vaccine. I've heard of some places, I know the chamber would get mad if they heard me say this. I heard of there's a hospital in Houston that actually gave every employee $500 if they got the vaccine.
Wow.
I hope Sandy's listening now, Dr. Grant. I mean, I hope he wasn't listening when you said I had to work the day I got the vaccine, but now I hope he's listening.
Yeah. So there's all sorts of things. I can't say business. And like I said, our leaders have got to take it. Lead by example. Get the vaccine. Show your team, you know what? It's good for me. It's good for my family. I want you to do everything you can to get it too.
Perfect. Thank you for that. Very good point. Lead by example and just make sure that you share your experience with others so they know it's safe and effective. Okay, so a question about supply chain. Can you please discuss the supply of vaccines in the state and how these are distributed across the counties and to individuals?
Every day is a different day. and the state's actually being very, very on top of it to make sure that we get what they have. In the defense of the state, there can be a day that they're expecting 100,000, they get 50,000. There could be a day they're expecting 40,000, they get 60,000. So it's like a moving target, and it all depends what you get from the federal government. So the health systems are dependent on the state. The county health departments are depending on the state. The state's depending on the federal government, and no one has a predictable answer of when they're going to get the vaccine. No one has like I said, the numbers are what they expect versus what they get.
Thank you for that. One last question before I turn it over back to Brad. Do you know of any long-term side effects, or do we have this information yet? I know that obviously we only started vaccinated people not that long ago, but are there any long-term side effects of the vaccine that we're aware of at this point?
Well, I think that we don't know of any long-term side effects, if for no other reason we haven't had long-term to the vaccine. I think the first vaccine was actually given December 18th.
Right.
I mean, we had the 40,000 people that were actually in the trials. So if you add them in, they were a little earlier. We haven't heard any long-term side effects yet.
Thank you so much, Dr. Grant. We've had some great questions, and we appreciate you being here with us. So, Brad, any last questions or insights?
Yeah, I do have one closing question, but one question I forgot to ask, that it's going to be a long lunch hour at home if I don't ask it, because I have an 11-year-old who hasn't been to in-person school for a year and is very concerned about the fact that there's no vaccines authorized for children yet. How concerned should we be about the fact that children can't get vaccinated? And do you expect that we will have a vaccine for children? And if not, is that even necessary?
The jury's still out on that, Brad. We're talking because children actually, they respond to vaccines a little differently. So we're just trying to get adults. They're working on that in the background. Everything I've read, it's looking towards, if children are going to be vaccinated, it's going to be looked towards the end of 2021.
Okay. So the last question before
wait, I thought that was the last question.
No, this was the question to make it so that I can get through my lunch hour without getting chastised for not asking the one question I was required to ask from breakfast. The question I did ask have to ask was, it's 2021, it's a brand new year, right? And everyone's looking forward to getting back to normal. But, like you said earlier, it's not going to be, a date certain where we can all throw our masks away and have a big party in the streets. It's going to be a gradual normalization. But do we have do you have kind of a marker that we can all look out there and say, yeah, if things go the way we think they're going to go, by Labor Day or by Thanksgiving, we can have a reasonable expectation that, things are going to look more like 2019 than they do like 2020?
I can only tell you what we sort of know on February 2nd, 2021.
I will not hold you to this.
Okay, good. I hope you're not recording this because I can see you actually shooting it off to me. Everything we're saying, if we can get enough people vaccinated, and if we can get the herd immunity, and if we can get the numbers down, we're looking Q3, Q4, more like, early fourth quarter.
Okay.
Hopefully by January 1st, 2022. I mean, there's talk about not getting everyone vaccinated in 2021. Well, we'll have to see what the numbers are. If we get the numbers down, let's shoot for Christmas 2021. I mean,
all right, I can do that. I can do that. I mean, we've been sitting here for a half hour and the door still hasn't knocked, so I guess I'm not getting my shot today, but I can sit here and wait. We've been patient for a long time. I think we can be patient longer, but I appreciate, Dr. Grant, all the time you have spent with us today. And I appreciate the folks who've sat here and gotten your advice. And I hope you will take it. And I hope you will share it with your friends and family, because if there's one thing we all can do to get not only our own lives back to normal, but the lives of the 330 million Americans who've been living with this for the last year, is to get our shot. Whether you are a 95-year-old grandparent or an 18-year-old just eligible to get the vaccine, if we get our shots, we're doing our part to get back to normal. So
Yeah.
listen to your doctor, listen to this doctor, and get your shot when you're eligible. And we look forward to being of service to you. We're going to post this webinar on our website. I think this one will be hopefully especially helpful to your friends and family. Hope you'll share it. And there's a wealth of information about COVID-19, how you and your business can respond on the Chamber's website, detroitchamber.com/COVID-19. And if there's anything else that your chamber can do to be of service to you, please don't hesitate to ask, and we will look forward to seeing you again next time. Dr. Grant, thank you so much.
Thank you for having me.